Back with Dr. Diez, Tampa dentist. Dr. Diez, lots of people, some of us, we have missing teeth. And I'm talking about 2, 3, 4 missing teeth in the back. Because usually in the front, we run to a dentist rather fast. It just looks too ugly. But in the back, we seem to be a little careless about it. And we don't seem to be seeing much negative reaction. Yet, dentists like you keep telling us you've got to fix it. Can you shed some light on it, where this disparity comes? We kind of don't feel much is happening, so why spend a couple of grand of fixing the whole thing? And yet you say, look, you must, because what? What's going on?
Well, the problem is the effects of losing teeth. It takes most of the time several years to show up. The simplest way I can put it is your teeth are in a certain position for a reason. That's the way we were built. That's the way we were made. Mm-hmm. When you lose teeth in the posterior area, those spaces allow the other teeth that exist to start moving and shifting around. Okay? What happens when those teeth start moving and shifting around is then our jaws, the joint in our jaw, the muscle that controls our jaw, has to work in an unusual manner in order to allow us to chew, because now the teeth are getting in strange positions. A lot of times I'll explain it to my patient. It's no different than a pro athlete, a professional baseball player, okay, a pitcher. How many pitchers do you hear damage their elbows, their shoulders? The reason is throwing a baseball is not a natural motion. You are best way for me to put it, you are abusing certain parts of your body. Well, when your teeth shift around, you are forcing your body to work in an unusual manner, just like a professional pitcher does with his arm and his shoulder. And over the years, that has a very destructive effect on the body, and that part of the body.
Okay. So what you're telling me is kind of like the teeth start shifting, but they start shifting slowly. So it's like your backyard or maybe your front yard fence, which all of a sudden it looks awful ugly because it's kind of like, the balls go left and right, and it loses its function because now every cut the dog can come in and out. Because it's not anymore the way it's supposed to be. And it goes so slowly. Now, does that mean if your teeth are shifting, you could be starting looking ugly in front, even though your teeth are missing in the back?
Oh, it happens all the time. Yeah, because when the posterior teeth start shifting, right, a lot of times they'll shift posteriorly. Well, that creates space then for the teeth in front of them. It's a chain reaction. Okay. And then those teeth in front start shifting. It happens very frequently where then you start getting spaces and teeth turning and rotating in the front because the teeth in the back have moved. They've created other spaces that allow the front teeth to move.
Right. And that, of course, means major orthodontic work over veneers and crowns and stuff like that, which, again, is surgery and money. Now, let me ask you, I'm a mechanical machinery engineer from profession, so a little bit like your dad, I guess, or, we're a little bit working with the hands. Now, when a cogwheel is misaligned, that machine eventually starts cracking all over the place. So when you have those teeth the way you're talking, and if I look at it from that, like you have those hinges here, I think you guys have a name for it. I can never pronounce it. I don't even attempt to do it. So wouldn't that stuff go all out wacko? And could it be that some people have muscle tensions in their neck, in their lower back, shoulder, and even headache because of that stuff being out of alignment? Never mind the ugly looking.
Yeah, that's exactly what I was talking about. The muscles, everything starts working differently. That joint, which the TMJ joint, most people know it as the TMJ, starts working in an unusual manner. That affects the muscles, and not just the muscles you chew with. It affects the muscles in your neck. It goes down your back. You can have all kinds of problems. You get headaches, neck aches, and it's been proven. A lot of it can be related to the way the jaw is functioning, or the way it's malfunctioning.
Mm-hmm. So let me ask you. Let's just say you have a person who has those muscle tensions, maybe headaches, migraine, whatever, for a while now. And he has tried some remedies, gone to a chiropractor, did a little acupuncture, whatever, did some things. And it just doesn't seem to be going away. So he starts learning how to live with it. Regardless of whether he has missing teeth or not, because I've heard that this jaws can go out of alignment anyway. Maybe the teacher flaps you too heavy on the head in the back when you were a kid, and it's out of alignment ever since. So would it be prudent for such a person who doesn't get rid of his discomfort, which is very, very handicapping for the job throughout the day, having a slight headache, having a slight tension? I know when sometimes I get it, even driving becomes dangerous because you don't want to look in the rear mirror the way you normally do. You can't turn. So anyway, it becomes handicapping for career, for all kinds of things. So such a person, would it be prudent for him, whether he has missing teeth or not, but especially if he has missing teeth, that he goes to a dentist who knows about aligning the mouth and A, fixes it if it was the cause, or at least eliminates it and says, no, that's not either. You've got to keep looking.
Of course. Especially like you said, if someone has tried different avenues, chiropractors, whatever, and they can't solve the problem, they should have an evaluation by a qualified dentist, a dentist who can evaluate their bite, the way their teeth come together, the way their jaws come together. And like you said, it doesn't mean that that's always the problem, but many times it is, and it should be eliminated. In other words, if the jaw is out of alignment and the patient has sought treatment in other medical fields, other medical areas, then by all means, treating the position or the malposition of the teeth is highly recommended.
Wonderful. Well, thanks for your candid and very informative information here. I'm sure it will help people. Thank you very much.
Thank you.